This is Tar Heel Talk, an in-depth look at the issues and people making news in North Carolina. Here's your host, Sonia Williams.
According to the U.S. Department of Health and Human Services, 20 people die each day waiting for an organ transplant, and every 10 minutes, another person is added to the transplant waiting list. On today's show, we'll take a closer look at how these numbers translate locally and in minority communities. And joining me now is Dr. Julius Wilder, gastroenterologist and hepatologist with Duke Health, and Carmelita Spicer, Director of Programs and Marketing for Community Health Coalition in Durham. Thank you both so much for being with us.
Pleasure to be here.
Thank you.
Now, we just heard a lot about the numbers and the need for organ donors and how many people are waiting on a daily basis. Talk a little bit about how those numbers translate in the Triangle area and Durham community.
So there are a number of factors that come into play. I mean, we're talking about around 90,000 people on the waiting list for kidneys, about anywhere to 14 to 16,000 people that are on the waiting list for livers, which are the more common types of transplant that we do in this area and as well nationwide. But in terms of the availability of those organs, it's only a fraction of organs that are available. And then of course we're adding new people to that waiting list every year. And so the question becomes, what are some of the things that we can begin to do to begin to address that gap in terms of what's available and the need that is there? And then further complicating it, and particularly relevant to us here in the Durham community, is the fact that a lot of minority populations are disproportionately represented on that waiting list, particularly when you're talking about liver, particularly when you're talking about kidney. And so we're beginning to have discussions within our community to think about ways we can begin to provide people with education around the importance of organ donation, which is going to be vital to our ability to bridge that gap, and other opportunities to address these problems like living donation and those types of resources as well.
And that's where organizations like the Community Health Coalition come in terms of helping to educate people about organ donation. Carmelita, talk a little bit about the Community Health Coalition and your mission to help educate the public.
Okay. Community Health Coalition is a nonprofit, and we've been in existence for 29 years. We were founded by a doctor, Elaine Hart Brothers, who is an internist. And our mission is to reduce health disparities within the African American community and, of course, promote health equity. So many of our people die from chronic diseases and disorders like kidney failure, dialysis, high blood pressure, heart failure, hypertension. And, of course, all of those chronic disorders lead to the need for organs. We were recently granted or awarded a grant to look at organ donation within the African American community and encourage our people to become organ donors. The need for organs among our community is far greater than our willingness to give. So our mission has been to inform the public about the need, inform the public about the importance of becoming an organ donor, and dispelling a lot of the myths associated with organ donation, especially within the African American community.
We want to talk about that in just a minute, but first, Dr. Wilder, when you talk about having minorities be organ donors, why is it so important that more African American and minority populations become organ donors?
Certainly. When you look at what are the underlying health factors that contribute to kidney disease and then end-stage kidney disease. When you look at the health problems that contribute to liver disease and then end-stage liver disease, what you find is that African Americans particularly are more likely to have those health problems. And so hypertension or high blood pressure, diabetes, these are all things that we know contribute to advancing the likelihood of having end-stage renal disease or kidney disease. The same thing happens with liver. And so number one, we're more likely to have risk factors for organ failure. And then that's compounded by the fact that then we are underrepresented in terms of individuals who are willing to be organ donors. And depending upon the type of organ you're talking about, there can be factors at play in terms of being able to find appropriate matches. Right. You know, certainly with kidney and liver, they're much more forgiving in terms of your ability to find donors. But there are other scenarios, like with bone marrow transplant, for instance, that it can be more difficult to find appropriate donors for individuals. And so when we have disproportionate representation in terms of the risk factors for organ failure, and then we are less likely to be donors, and we already have a significant gap at baseline in terms of what's available and in terms of the need, then we're really sort of setting ourselves up to be really at a great disadvantage in terms of our needs when it comes to organ donation.
Why is there, I guess, that gap in the need and the availability of organ donors? I know you were talking about some of the myths and some of the concerns that may be out there. Talk a little bit about some of those and maybe give us some of the actual medical facts.
Our people are very reluctant to becoming organ donors. And a lot has to do with our history as a people. We're
as African Americans.
As African Americans,
yes.
right. We're apprehensive about clinical trials, about the whole process of how we'll be treated if we are on the registry to be an organ donor. We feel that if there's an accident or if something happens and they determine to find that we are an organ donor, we may not be given full treatment. They may let us, these are things that I've heard in speaking with the market, the African American community, that they're willing to let us die so they can use our organ. We're very distrustful. The other thing is we're fearful also. A lot of us feel that, we came with all of our organs, we want to die with them. That's part of the religious aspect. Many of them feel that they can't have an open casket funeral, and as a people, we do believe in funerals, and we want to make sure we look our very best at our end of stage. So we're concerned that we can't have an open casket funeral. And we're reluctant because we do have a lot of chronic disorders that our organs are not usable. So I've heard, well, I'm too old, or they can't use my organs anyway. So we have to explain that one person's life one person who donates can possibly save up to 8 people's lives. And while you may have diabetes, so maybe your kidney isn't usable, but there are other organs that may be usable. So that's our mission, to dispel the myths, to talk about the realities, and to continually encourage us to become an organ donor.
Right. And Dr. Wilder, I want you to address, we're going to talk about this more in the next segment as well, but I want you to address one of the myths that Carmelita mentioned, and I've heard that as well, is that if doctors find out that I'm an organ donor, I may not get the best care if I go into the hospital.
Yeah, that's absolutely not true. The first and foremost, when coming to the hospital with any health issue, the primary goal is going to be to do the best that we can to provide the best care for that particular patient, and ensure that we do the best we can to get them better and to help them live.
Absolutely.
And that's really always going to be the case. And in fact, if you really look at it, hospitals and physicians are judged, in a certain way to how well they're able to take care of you. And so if they were allowing people to die, there could be repercussions, in fact.
Absolutely.
And so besides the moral aspect, where we're always going to do the best we can for people, there can be some disincentives to allowing people to die for the sake of obtaining organs.
Absolutely, that's important.
Yeah,
that's
so
very
that's
important.
definitely not the case. Yeah.
Okay, we're going to take a break. We'll talk more in just a minute.
Great.
Up next, he's been on the transplant list for about 2 years now. We'll hear his story and how you might be able to help after these messages. Today's show focuses on organ donation, and with us again is Dr. Julius Wilder, gastroenterologist and hepatologist with Duke Health. Also joining us is Dr. Lewis Rowland. Dr. Rowland is on the kidney transplant list. Thank you so much for being here.
Well, thank you.
Dr. Rowland, you've been on the transplant list for about 2 years now.
About 2 years, yes.
Take us to the point where you discovered that there may be an issue and what was going on.
My primary care doctor was Dr. Elaine Hart Brothers, who was head of the Community Coalition. And my numbers kept rising, getting higher. And she discovered that I needed to see a specialist. Okay. And I saw the specialist, the kidney specialist. And because I had so many incidents of hypertension, diabetes, and was just coming off of prostate cancer, all of that was, leading to this tragedy of kidney failure.
Right. Kind of the perfect storm.
The perfect storm, right. Well, I wouldn't call it a tragedy, but it's something that I had to live with.
Right.
And anybody who has kidney failure can live a long life if they do what they are told to do. So I had to make a decision to take that step into kidney dialysis. Okay. At the time, I was a member of a support group. About 15 men, African American men, would meet every month at Lincoln Community Center, Health Center, and we would discuss prostate cancer issues, which was a big support to me because I was out there by myself not knowing what to do with this kidney failure. So I leaned on them to assist me in getting through it. And of course my wife, who's been with me for 57 years.
That's wonderful.
That's a long time, that's wonderful.
So I needed all the support I could get. And it was a tremendous shock to my system that I had to go into dialysis daily. So I ended up going into what is called peritoneal dialysis, what we call PD. And I did that for about 1 year. And that's a system where you have a machine that you stay on, hook you up to the machine, and you clean your blood waste through that system for 10 hours a night.
Wow.
So I did that for a year. And then I got on, I decided that this was a little too much for me and my wife. So I got on hemodialysis. And I just got on that recently, and that's working out well. That's when you go to the hospital, to the clinic, to the center, 3 days a week. I go on Monday, Wednesday, and Friday, and I stay for about 3 hours each day. And that's going well. So that was my experience in going through this shocker to my system of realizing that I had to go into on dialysis.
I can imagine that news can be overwhelming. And Dr. Wilder, I'm sure you are very familiar with all the things that Dr. Rowland has described as someone who is in kidney failure. Yeah,
the story that you're telling is really what we're seeing, unfortunately, in many of our patients, and unfortunately, as we discussed earlier, disproportionately in our African American patients, where for a long time they have underlying high blood pressure and diabetes. They may not be well controlled. That can be very difficult for particularly our minority populations because of a lack of proper healthcare resources at times, or just not being aware of these health issues until it's too late. And then the combination of those two things together can contribute to any number of organ issues, including, end-stage kidney disease or renal disease. At which point in time, kidney is a little unique in that you have an option outside of transplant, i.e. dialysis of some type, where you can use a machine or a procedure, the peritoneal dialysis, to sort of do what the kidneys would normally be doing.
Is that a long-term solution, or is there a point where you are put on the transplant list, and how does that process work?
So it can be particularly hemodialysis, it can be a long-term solution, but there is a lot of morbidity associated with it, i.e. There can be issues with infections, bleeding, as you're kind of dealing and having to go through these dialysis. You have a lot of blood, you have a lot of injections, you have to have access to your bloodstream, and that sort of creates opportunity for infections and things of that type to sort of come into play. And so while it can be a long-term solution, you're sort of walking a fine line in terms of the risk-benefit in that setting.
Right.
Yeah.
For people who may be watching and may be concerned about donating a kidney or any other organ, what advice would you give them just to explain the process, how simple it is, and the importance?
You know, I think when thinking about the idea of becoming a donor, the first thing you need to do is have a conversation with your family and make sure that everyone understands how important it is to you, why you want to give this gift, one of the most precious gifts you can give. And you make sure they're on board and understand that that's really what your goals and desires are. It's very, very easy to become an organ donor. There are a number of websites, and you can actually find a link through the Community Health Coalition website for signing up to be an organ donor. And actually, most individuals, particularly in the state of North Carolina, can do it on their driver's license. It's an option to select yourself to be a donor, you know, that way as well. And so it's a very, very simple thing to do. And really, folks, I know, you know, we talked about a lot of the myths, and a lot of individuals think they may not be candidates to become an organ donor, but go ahead and become an organ donor. You know, let us, the physicians and the transplant team, when that time comes, help us, you know, allow us and your family to come to that conclusion if you're a good organ donor. But at least if you make yourself an organ donor, it's possible. If you never sign up to be one, you'll never be an organ donor.
Absolutely. And again, people can, it's as simple as going to the Community Health Coalition's website, which is chealthc.org, or they can call 919-470-8680 and get more information about the process. Dr. Rowland, as you've been going through your dialysis over the past 2 years and coming to terms with, you know, having kidney disease, what would you say to someone out there who may be watching today who isn't an organ donor about why it's so important to become one?
It's interesting. I was a very active person. I was a golfer. Played golf all the time. And that's why my knee is messed up now. But we were at a party, and Miss Carmelita was with me. It was Spicer was with me. The Community Health Coalition had put a party on, and my wife and I went to the party. And when I get in front of a large group, I always like to tell them, if they ask me to give me a chance to speak, I'll say to them, I may not look like it, but I have a need for a kidney. I have a kidney failure. If anybody is interested in giving me a kidney, I will accept it, readily accept it. And to my surprise, there was a young lady in the back of the room at the end. She came up to me and my wife and said, I want to be tested or measured for a kidney to donate to you. I mean, that almost blew me off the floor, off the seat. So I've been dealing with, working with Baptist Hospital in Winston-Salem. And I gave the young lady's name to them, and so I guess I'm going through a process now of being tested and measured and evaluated, and I guess that will be one of the people that, but one of the things that I noticed is that there are very few African Americans want to donate for some reason. I mean, it's a fear of something. But it's so many, I mean, when I go into these dialysis clinics, I see so many African Americans in there receiving this treatment, which means that we need to have some way of responding to this crisis.
Absolutely. Very important to get that message out, and it's wonderful that you are willing to stand up and let people know what you're going through and encourage people to donate. And Dr. Wilder, people can select who they'd like their organ to go to. Is that correct?
Absolutely.
Is that how it works?
So, yeah, so what's really neat about where we have come to this point in time in terms of medicine and technology is the living donor option that Dr. Moore was describing. So essentially, you can take one of your kidneys, and if there's an appropriate match and there's a sort of a process involved of ensuring that it's a safe match, I can give a person, one of my kidneys, and I live off of my one kidney, and that person, even though both of their kidneys have gone away, and my one kidney can support them, I can give you half of my liver, and that half of my liver will grow to a full-size liver inside of you, and my liver will grow back to a full size. And so there are a lot of neat options that are out there. We just have to be, educated and engaged. So,
absolutely important to educate the community about this. Dr. Wilder, Dr. Rowland, thank you so much for being here. We wish you all the best. You're looking great, and we just pray that things work out and you find your kidney. Thank you for being here.
Thank you.
We'll be back with more Tar Heel Talk after these messages. Welcome back to Tar Heel Talk. I'm Sonia Williams. According to the U.S. Department of Health and Human Services, 20 people die each day waiting for an organ transplant. And every 10 minutes, another person is added to the transplant waiting list. We've been talking today about how those numbers translate locally and particularly in minority communities. Joining me now is Carmelita Spicer, Director of Programs and Marketing for the Community Health Coalition, and Teska Kynard. She is a heart transplant recipient. Teska and Carmelita, thank you both again for being with us. I know, Teska, your battle with heart disease started when you were relatively young.
Yes.
Tell us about your experience.
I was first diagnosed at the age of 16 doing a sports physical, and I was diagnosed with having a heart murmur and then enlarged heart. When he realized that I had the heart murmur, he decided to do further testing, and it was our family physician at that time. And years passed, and then maybe like 3-4 years later, I was diagnosed with having high blood pressure. And at the age of 29, it's when I was diagnosed with having mild congestive heart failure, which was during the time that I was expecting my second daughter. And at that time, my blood pressures skyrocketed to stroke level, and in my third trimester is when I was taken out of work. I was put on bed rest for a month, and because my blood pressures were so high. And after that, during delivery, is when my heart went into heart failure while on the table of giving birth to my second daughter. And maybe a week and a half later, I started feeling really, really bad. And I went back to the doctor because of my family history of heart disease, because my mother died at the age of 48 of a massive heart attack. But I didn't realize until all of this was going on with me at the age of 29, and I found out that I was in mild congestive heart failure. It's when my dad told me that my mother had the exact same thing, suffered from mild congestive heart failure 5 months after having me. And then at that point, I was diagnosed with having idiopathic cardiomyopathy. And from that time on, my health started to decrease. And I was out of work for several years. I went back to work, and my health started to go up and down like a yo-yo. It fluctuated, here and there.
Right.
And
at some point you were on the heart transplant list.
Exactly.
And you got that call.
Exactly. In 2011 is when my heart started to decline again, my health. And 2012, it was still deteriorating. And it got down to, my heart function was down to less than 10%.
Wow. We have about a minute left in the
Yeah.
program. I know you have a very powerful story.
Yes.
We'll probably have to have you come back and complete that story, but you did receive a heart
I did
transplant.
on June 2nd, 2013. I received my heart, and that's a day I'll never forget.
Right. You got
So
a
I'm
new
coming up
lease
on my
life.
5 years.
That is
June
wonderful.
2nd.
That is wonderful.
Yes.
And Carmelita, that's why it's so important for people to get on that donor list. How can they do that?
Excellent, thank you. Teska is our spokesperson. She's a heart recipient, and we've created a documentary. We encourage you to see it. If you go to chealthc.org, that's our website. There's a link there. If you click on it, you will see the documentary. You can call us at 919-470-8680. You can go to YouTube and type in Precious Gift of Life by Community Health Coalition.
And
you can see the documentary.
And hear more
Remember,
about Teska's story. It's
one
a very
person
powerful
can save
story.
up to 8 people's lives.
And that is so important. Ladies, thank you so much for being here. And we'll definitely have to have you come back and share more about your story.
Okay.
All right.
Thank you.
That's it for this week's Tar Heel Talk. To comment on this or other episodes of the show, like us on Facebook, follow us on Instagram, or send us an email to tarheeltalk@fox50.com. I'm Sonia Williams. Thanks so much for watching. We'll see you again next week.